This is Radio Health Journal. I'm Nancy Benson. This week, lung transplants, risky procedures with a long waiting list.
Because of this constant exposure to the ambient air, lung transplant patients are more subject to acquiring infections and possibly rejection episodes.
How lung transplants are getting better when Radio Health Journal returns.
I'm Reed Pence, the producer and host of Radio Health Journal. If you like listening to Radio Health Journal, you'll also like our sister show, Viewpoints, which covers a wide array of topics from education to history to the environment. Here's a preview of what they're covering this week on Viewpoints.
If trauma doesn't come then, if that kind of injury to us doesn't come during young adulthood or midlife, it will definitely come if we're lucky enough to grow old.
Trauma, just another part of life. Then
I found that with touch, my ability to feel you, see you, sense what's happening for you. If you carry tension or stress in certain areas in your bodies, I can interpret that.
The benefits of being cuddled. I'm Marty Peterson.
And I'm Gary Price. These stories in depth this week on your public affairs magazine, Viewpoints.
Listen to Radio Health Journal and Viewpoints on your favorite radio station. And subscribe and listen anytime on Apple Podcasts, Google Play, and Spotify. Also, follow us on Instagram and Twitter at Radio Health Journal.
Miriam Marianos is a California woman in her 40s who came down with the flu a couple of years ago. Nothing unusual about that. But her case ended up as anything but routine.
Her body reacted to it such that her lungs were damaged, and she had lung failure. And she had to be on a machine, the ventilator, for some time, and then subsequently was placed on ECMO.
ECMO is just about the highest level of life support available, according to Dr. Abbas Ardahali of the UCLA David Geffen School of Medicine. He says the machine completely takes over for the heart or lungs for a short time. A patient sick enough to be on ECMO is usually high on the transplant list and can be transplanted quickly. But Miriam was on ECMO for 9 months.
Traditionally, the duration of ECMO support has been in the order of days. However, more and more with the advances in devices, we are able to support patients for durations extending into weeks. For someone to be on ECMO for in excess of several months, it is virtually unheard of, and then subsequently undergo successful lung transplantation. And that is what's exceptional in Ms. Marianos' case.
The problem for Miriam was that she was no ordinary lung transplant case. Ardahali is professor of surgery and medicine and director of heart-lung and heart-lung transplantation at UCLA, and says that Miriam was so risky that she was turned down by more than 20 other transplant programs around the country.
There were two areas which made her case very high risk. One was that her body had developed proteins in her bloodstream as a result of her prior malignancies or blood transfusion, such that there was a very high risk of rejection immediately after transplantation. The second risk factor in her case was that she was on ECMO for a prolonged period of time, and as one can imagine, with all your blood coming outside of your body and then being oxygenated or pumped by an external machine, inevitably leads to organ injury and other organ complications.
However, without a lung transplant, Miriam would die. How could a transplant be more of a risk than that? Ardahali says it's not just the risk to the patient that prompts many transplant centers to turn down a case with a high risk of failure.
We are taking a scarce organ that could potentially save someone else's life with a greater likelihood. Therefore, in the setting of scarce donor organs, one can make a case that it is in the society's best interest that these organs be used for individuals with the greatest likelihood of survival.
What's more, transplant centers also have to look out for themselves. They often may feel that failure is not an option. They'd rather take a pass.
Smaller or less experienced transplant centers, when they have a failure like this, it affects their scorecard and it could potentially impact their approval by the Department of Health and Human Services and Center for Medicare Services. And as such, most transplant centers are hesitant to accept very high-risk cases when the prognosis is not relatively in the high range.
However, as one of the world's largest lung transplant programs, UCLA was willing to take the risk of Miriam's case, but everything had to be just right.
We specifically looked for a donor that has the least risk of this rejection. As you well know, each donor has their own proteins, and we looked for a specific donor that we felt the risk of rejection can be minimized. The second measure that we undertook was that we lowered the level of the proteins in her blood immediately before transplantation. Number three was that we altered the immunosuppressive medications that all organ transplants receive in her case after the transplantation, such that her immune system is under direct control to minimize the risk of this rejection to occur immediately after organ transplantation.
Surgery went well, and the anti-rejection protocol worked. Miriam was back home in about a month, and a year after surgery, Ardahali says she looks a lot like any lung transplant recipient. She's healthy and getting back to normal, or at least as normal as anyone with respiratory risks in the middle of a pandemic. But that kind of happy result isn't available to all the patients who need it.
Among liver, kidney, heart, and lungs, lung transplantation is the least commonly performed operation for organ transplantation. That is not because there are not many patients waiting or needing lung transplantation, but it's mainly because of the fact that organ transplantation, specifically lung transplantation, is constantly exposed to air that we breathe. As such, lung transplant patients are more subject to acquiring infections and possibly rejection episodes. What we do know is that the risk of chronic rejection in lung transplantation is higher than kidney, liver, and heart transplantation as well.
Last year, about 2,700 lung transplants were performed in the United States, compared to 3,500 hearts and 23,000 kidneys. Other organs aren't damaged in the death process, as lungs often are, making them unsuitable for transplant.
When the donors become brain dead, they are likely to have aspirated fluid or gastric or stomach content into their lungs at the time of brain death. Therefore, lung donors are less commonly available as compared to kidney or other solid organs.
Despite those factors, lung transplants are increasing rapidly. A variety of end-stage lung diseases may put a person on the transplant waiting list.
One of them is what we call pulmonary fibrosis or lung fibrosis, which is scarring of the lungs, where patients require additional oxygen, and the scarring is so progressive that many of these patients die if they do not undergo lung transplantation. Patients with advanced stages of cystic fibrosis or other types of lung infections. Many patients with advanced stages of emphysema related to smoking may also benefit from lung transplantation. And lastly, there is a class of patients that are diagnosed with pulmonary hypertension.
With a lack of available organs, patients with conditions such as cystic fibrosis are turning to new options like gene therapy. But the demand for lungs and other organs will likely always outstrip the supply. That's why Ardahali says people who sign an organ donor card and the relatives who say yes to donation are the real heroes. He says one person's organs can save the lives of 8 to 9 others. You can find out more about all our guests on our website, radiohealthjournal.org. Our studio producer is Jason Dickey. I'm Nancy Benson.
Radio Health Journal returns in just a moment.
Now there's even more reason to get flu and pneumonia shots. They may help cut the risk of Alzheimer's disease. Studies reported at the Alzheimer's Association International Conference 2020 show that flu vaccination, especially at a younger age, may cut Alzheimer's prevalence by 17%. And getting a pneumonia vaccine between age 65 and 75 may reduce Alzheimer's risk by up to 40%. Dr. Maria Carrillo is Chief Science Officer of the Alzheimer's Association.
Vaccines are at the forefront of public health discussions today, and these new studies suggest that their benefit goes beyond preventing viral or bacterial infections. If these findings can be confirmed in larger and more diverse groups, then taking care of your health by getting vaccinated may also lower your risk of Alzheimer's and other dementia.
What's more, growing research is investigating whether infections themselves might worsen or even cause dementia. Find out more at alz.org.
Supporting immune function through a healthy diet has become an important new focus for many people these days. One key recommendation is to eat more vegetables and fruits, such as grapes, every day to improve immune function. Combining grapes with vegetables can help achieve this goal in a tasty way, according to registered dietitian Courtney Romano, health advisor for the California Table Grape Commission.
Fresh grapes are heart-healthy and hydrating, and linked to benefits in multiple areas of health, including supporting immune function. Grapes are always a smart snack choice on their own, and they also pair well with other healthy foods, such as vegetables, to enhance flavor and nutrition. Add grapes to a kale, spinach, or arugula salad. Roast grapes with cauliflower or broccoli. Combine grapes with cucumbers and feta for delicious, healthful eating.
Grapes from California are a natural source of antioxidants and other polyphenols. Visit grapesfromcalifornia.com for more information and over 300 recipes.
What are you going to do with your old car? You can try selling it, you could junk it, or you can donate it to Heritage for the Blind. Your car will be towed away for free, and your donation is tax deductible. Just call 1-800-835-1478. Heritage for the Blind accepts cars, vans, trucks, and boats. It doesn't matter if your vehicle runs or not. It will be towed away for free, and you'll be supporting those that need help. Heritage for the Blind is a nonprofit organization that helps the visually impaired live fuller lives. Call right now to donate your car, and as a special thank you, you'll receive a free 3-day vacation voucher to over 50 locations. Call Heritage for the Blind right now. Call 1-800-835-1478. Donating is easy, and your vehicle is towed away for free. Plus, you'll get a free vacation voucher for donating. Call now, 1-800-835-1478. That's 1-800-835-1478.
And that's Radio Health Journal for this week. Radio Health Journal is a production of MediaTrax Communications. Follow us on Twitter, Facebook, and Instagram to learn more. And check Apple Podcasts, Google Play, and Spotify for a library of past programs. Plus, you'll always find previous segments and information about our guests at radiohealthjournal.org. Join us again next week for another edition of Radio Health Journal.
Coming up next week on Radio Health Journal.
Not every jurisdiction in the United States can safely open schools right now full time.
Opening schools with all the demands and precautions, is it going to happen?
Then dealing with work-at-home burnout and Zoom meeting fatigue.
It feels like it's even more exhausting than going to work physically at the office and having the same number of meetings in a day.
All that and more on Radio Health Journal.